Hi, this is my first video to do for you guys. I'm not really a pro at this whole podcast go live thing, but I have a lot to share, and I felt like to make my life meaningful, I wanted to start sharing some of what I've gone through in my life and hope that it helps some of you. Today I'm going to talk about trigeminal neuralgia. Most of you guys don't know what that is, maybe. It's called the suicide disease. It's basically about, I'm not a doctor or a nurse, so disclaimer, all that good stuff. Most of us have an artery or a vein wrapped around a nerve in our brain called the trigeminal nerve, and it feeds into, one goes into the eye, one goes into the, like right here, into the lip, and the other one goes around here into the mouth. And it's a progressive disease. It's incurable. So progressive meaning it gets worse. Most of us have, if you ask us when we were diagnosed, we can tell you the exact date, even if we have bad memories, which I have massive memory issues for many things, but I can still tell you it was December 6th. The year, I would have to do some math, but I know the exact date because it was, just like an anniversary or marriage. It was a very big date in my life. It changed my life forever, which is why I'm making this video, because when you get that diagnosis, you're lost, you're scared, you don't know which doctor to go to. Sometimes it takes weeks, which feel like years. When you're in a 10 out of 10 pain, it feels like years. And God's given me a lot of medical knowledge. I was raised in a medical family, so I have a lot of knowledge to share with you guys, of just things that I've come up with, things people have shared with me. I've had this disease for I'd have to do the math. It's gonna go in 8 years, maybe 7 or 8 years. And I have a myriad of things to share. So with all that, I'm gonna just stop yammering and start sharing some stuff. I'm happy that I'm able to talk calmly with you guys, and I can tell that my face isn't tight. Sometimes you can actually see, and as you have the disease, you can realize that, wow, I can't smile, or, you'll start celebrating the days that you can smile really big, which is kind of sad. They call us, pretty much most of us, we get that resting bitch face, they call it, because we don't really have much facial expression, and it's just natural, because if you break your ankle, you're not going to want to walk on the ankle. Well, it's kind of the same with the mouth. In some ways, your brain sort of turns off the thirst mechanism, because swallowing, moving your mouth, that hurts, and your brain says, ouch, don't move your mouth, don't do mouth things. Mouth things are talking, mouth things are eating, kissing, yada yada. So okay, so one of the first things I did, if you have trigeminal neuralgia type 1, which is the classic one, you'll have kind of minimal pain, I guess, once you get it stabilized, and then it will turn into attacks. You'll have attacks, and there's tons of triggers. This is stuff you probably can easily look up on the internet, what the triggers are and all that, but I'm kind of talking to those of you who have maybe had the diagnosis and are trying to figure out where to go from here and have basic knowledge. So on my refrigerator, I have a little sheet that when I have an attack, I can't talk. There's no talking, there's no communicating. Sometimes I'm in a ball screaming. Not to scare you guys that haven't been there or had it that bad yet, but I hated it when someone told me that it was only a matter of time before I would have brain surgery, and people would say things like that, how bad it got, and I would just look at them with deer in the headlights. But I'd rather have honesty, so I'm assuming that if I had a disease, I'd want to know what it would be like. So when you're waiting for pain relief, because the attack can come out of the blue, you can be fine 1 second and horrible the next minute. I was at a storage unit, and I literally told the person with me, I'm like, I'm going to have an attack. I said, just, you don't know me very well, but I'm going to need your help here for a little bit. So I was really grateful since I didn't know her and I needed help. I just pointed her to a list. And I put on my list, at least, blood pressure every 15 minutes, because our blood pressure goes up into the stroke range. It can, if you're in pain for a long time, and just depending on how your body responds to it. So having someone take your blood pressure every 15 minutes, keeping the cuff on. If I'm taking care of myself, it kind of also helps me if I don't have someone around. Like, you can't think straight, and you don't. It's very hard to think straight. So I keep the cuff on just because it's exhausting to put it back on. You need all the energy you can get to get through the attack. It's kind of like child labor, I would think. I mean, not child labor, having a baby, basically, you know, like, or a marathon, anything that you have to conserve energy. If I pass out, ensure that I'm still breathing. Put your hand in front of my mouth and on top of my back, make sure it's rising. Scary, right? Scary shit. Scary crap. I'm trying not to cuss. But for me, I have seizures, like episodes with them. Not everybody does. That's just me. The other one, only call 911 if I don't wake up or pass out for 2 minutes, or if there's no breath. Please don't freak out. This is just me. Those two are just me. Call 911 if the blood pressure bottom number is above 110, like if it stays there. Have a bowl in case I puke. Because again, I run out of energy really quickly, and the pain it's a steak knife basically being stabbed in your face. It's horrendous. I don't know how I can talk calmly about it, but I guess you just have to accept it. I mean, you learn to live with pain. I don't know how to explain it other than that. You think you won't for the first couple of years, and you do want to die lots, but you just find ways. And I found a lot of ways. So hang on, this is not all horrible, scary stuff. But crush up, and this is just me, but crush up my pink pill, which is a benzodiazepine for breakthrough pain. I can't move my mouth at all when I'm having an attack, and I wouldn't recommend this to people. This is just me, and actually I'm going to skip past this. If you want to talk to me about other things, you can just message me, because I don't know medically what the rules are with things, so just message me and I can share a little more. But the green pill box meds bring to me with Pedialyte. Well, I now actually have to do liquid IV, which is a box. There's some really good flavors. They have like pina colada, which is my favorite, but liquid IV. Because of the medicines I take, oxcarbazepine, the anti-seizure med, it causes low sodium in me, and in a lot of people it can do that. And so that's basically can cause your heart to do a lot of really not good things. Your heart runs on sodium and potassium channels, just like most of our body does. So my neurologist said when I started, they'll check your sodium when you first start taking those meds. I'm supposed to drink that like every day. But when I'm having an attack, it's super important, because dehydration, most of us are pretty much, the people with trigeminal neuralgia are chronically dehydrated. We just don't drink because our brain says don't drink because your face hurts. Like, and mine hurts all the time. I have trigeminal neuralgia 1 and 2, so it hurts all the time, and then I have attacks. So I have to remind myself to drink that, or other people do. So anyway, during an attack, I need to, and room temperature is absorbed quicker than cold. You might think cold feels better because you're sweating and hot and in pain, but room temperature is absorbed quicker. A straw. Some of you might not tolerate a straw. You have to kind of grin and bear it. So for me, when someone's bringing me my drink, I usually have a washcloth rolled up in my mouth, and I'm biting down on it because the pain's so bad. And so I'll take it out in between stabs, and then I'll take a quick chug through the straw, or you can And if you can drink it, that's fine. I have neck issues too, so, you know, doing that kind of hurts some. You know, just little bits by little bits. Getting the hydration in you will make a difference. The other thing is a washcloth for me to bite down on. There we go. It just helps. If you're a teeth clencher, you know, you're just, when your body naturally just clenches down when you're hurting. So the other one is a heating pad. Heating pad. Invest in an awesome heating pad. That's like, I can't emphasize that enough. Like, get the best one there is out there. It's worth your money. You're gonna have this disease for life. Sorry, it sucks to be part of the club, but I'm trying to pull mine out so I can show it to you. I didn't have all this ready. I'm really excited that I was able to put makeup on. That's not always a reality in my life, depending on pain and meds and stuff. Crying. Crying is not a good thing to do, by the way. It's a big trigger. So when you cry, just pretty much plan on having an attack right after it. Just, you know, it may not be a bad one, but just kind of be aware that if you're gonna cry, like, make sure your meds are in your purse. I always have meds in my purse and at home, always, and my car. I have them in my car or my purse at home. Or if I have a boyfriend, they're at his house too. I mean, anywhere I could possibly land, there's meds. Here's my heating pad. Mine is Body Med. It goes up to super high temperatures. It's really big. It's got a cover that's washable because you'll probably sweat, and it's got Velcro so you can kind of wrap it around your face. I'm gonna try to like show you guys sort of here. I mean, a lot of times it's just gonna be like this, because for me it's this right here that hurts, like right along there. So I will just curl up with this right here, because behind the ear is kind of where the vein starts to come out. And so for me, just right on the neck, along the jawline, not touching the face, because the face hurts to touch, so don't touch it. So I just do this number. You might, you know, if you have both sides, which sometimes I'll have both sides, even though I'm not it's only one side of my face that it has the artery wrapped around it, or the vein wrapped. Jesus, I can't talk, help me. The artery wrapped around the nerve is only on one side of my face. So, I mean, you can do this, you can, you know, that number. What I love is that it goes up to is an astronomical number, really high, and it stays on. And then of course you can like wash this, but it's hard to find ones that go up really high, probably because you can burn yourself. But you can't get hot enough when I'm hurting. I want hot, hot, hot on my face. So, okay. Let's see here. Another thing is you're gonna probably, like, I'm trying to think of everything here. Something to note, like, you might end up having an issue with dizziness and balance, and that's kind of tied to the sodium, so falls happen a lot. So I did invest in a shower chair. I know it sucks. I mean, I think I was like 35 when I got this, and I'm not 35 now, but I'm not gonna share my age. I'm gonna show you the shower chair. I didn't clean my bathroom, no judgment here. But it's a cute shower chair. I think I got it on Amazon. So there's the shower chair. I'm gonna just flip it around. Surely there's a way to do that, right? I'm tech savvy, maybe not. Okay. So yeah, sorry. It's like bamboo. I don't know. There it is. I'll take a snapshot of it for you guys if you want, and send it to you. Let's see. So Then there's topical. A lot of people didn't tell me about this, but I knew about this, and I was desperate for pain relief, and they weren't giving me a lot of things that were helping. And so I just know, like, I started looking up formulations, like combinations of medications that I'm actually going to grab mine 1 second. Okay, so, like, I know that, sorry, okay, jeggings are awesome, but, like, sometimes they're annoying. So this particular formulation has, and topical, like a compound pharmacy is who you'll go through. This one has ketamine 10%, ketoprofen, which is like a non-steroidal anti-inflammatory, 10%, baclofen 2%, cyclobenzaprine, which is a muscle relaxer, 2%, gabapentin, which is a nerve med you guys probably are on or might be on eventually, 4%. So it is very, very strong. So a very tiny amount, like this little bottle was, I think, $60. Insurance didn't pay for it, but it's gold. So I talked to Dr. Casey, who is the kind of the god, if you will, of trigeminal neuralgia. And he said that if you want it to be absorbed, like cross the blood-brain barrier, which means it actually gets into your system. For those of you that get drug tested or whatever, ketamine is it is a controlled substance, but you're not going to get high or anything off of it, especially if you're in pain. So anyway, there's a lot of studies done on ketamine. You guys probably know what it is. So putting it on, and this is going to sound crazy, but putting it on your forehead. So it doesn't matter if your face is hurting, putting it on your forehead will get absorbed. And that's what I believe. Don't quote me on that. My memory is really bad. Been in a coma. I've got some concussions, different stuff. So, but 99% sure. Forehead gets absorbed. Like, so during an attack, it's totally safe to rub that, and it should be on my list. I have like 3 lists, but I can't find my 3rd one. Actually, yeah, I do. Anyway, so these are amazing. And I found a study basically, and I brought it into my primary care doctor, and I just said to her, like, can you please, this study helps face pain, or it helps, like, I found it was done in some other country because America doesn't have enough funding for this disease. So if you guys are rich, donate to the Facial Pain Association. They're a wonderful, wonderful organization that helps a lot. If you have questions, you can call them, and they can try to help direct you. They can just answer questions. Support groups, they'll get you connected to support groups. Invaluable. Like, I think I talked to 2 people in my support group. A lot. I texted and called them a lot in the beginning because I was so scared and so lost. I mean, when you're hurting so much that you can't talk or eat, and you have home health coming because you've lost too much weight because you're not eating, and your neurologist is saying, I'm going to put an NG, like, feeding tube in you if you don't start eating, it's gotten pretty bad, so anyway, my primary care was awesome, and she was willing to write it, and send it to a compounding pharmacy. So if you have it all lined up, like, go to your neurologist, go to your primary care doctor, try to find, if you Google, I can try to send you the studies that I've looked up and stuff if you want. I'm happy to do that. And, you could print them off, bring them to your doctor, and then find out your compounding pharmacy. Sometimes working backwards helps, like talking to the compounding pharmacy and asking them what formulations they do for nerve pain or facial pain. and then they can send it to your doctor, kind of thing, and work backwards, and then your doctor can just sign it. So anyway, hopefully that made sense. I know there was something else I was going to say. You can also, before he told me about putting it on the forehead, I would put it like back behind the ear, like kind of where the heating pad was, like literally right behind that bump behind your ear, like right kind of next to the bump. And then I would sometimes very, very gently put it on the edge of my jawline. Another thing, there was a girl in the Trigeminal Neuralgia group. I can connect you to her, I guess, if it's legal in your state. It is not legal. I'm in Kansas now, so I cannot use it. But when I was in Missouri, they made their own marijuana cream, and they made a specific formulation for people with facial pain with trigeminal neuralgia, because it's so hard to get this pain under control sometimes. I lost my train of thought, so sorry. Oh my Lord. Anyway, God, that makes me crazy. I can't remember. Yeah. Okay, compounding creams. Dentists, dental cleanings. You will want to get a prescription toothpaste. The reason for this, it'll be when your doctor needs to write, like your dentist, just tell them, say, it hurts to brush my teeth. I need like something to make sure I don't get cavities, because Lord of mercy, you don't want to get a filling. During cleanings, I ask for laughing gas. I also take medication before I go. That also brings me, I'm going to throw in another quick tidbit. If you fly, like on an airplane, take Sudafed, because sometimes you'll have the air pressure will trigger pain. So Sudafed helps alleviate that. Okay, back to dentist. Laughing gas, and then yeah, I'll take a variety of things. I mean, just whatever's in your, whatever's in your toolbox, I guess. CBD oil, I know, is like a big rage now. It kind of helps. It kind of depends on, I mean, it does help. It's just kind of hit and miss. Sometimes it helps me more than others. I can't really tell you, like, there was Green Dragon is one from Oregon, that their formulation and their honey sticks, they were great. I live in Kansas, so can't get them like that easily. And I'm not even sure if they're around anymore, because they made a big difference. Like I don't know what kind of CBD they had, but it was really helpful. And then they had like a tincture spray, which I think I still have. Hold on a second. I do. It's called Sea Shot, and it is Green Dragon extracts. Green Dragon extracts, Sea Shot, just cannabidiol, or like no THC. A note on those of you that smoke, and if it's like legal and stuff, you do not like, underline this, boldface, you don't want any strain of marijuana that has limonene. It's L-I-M, I'm being serious here, Limonene, limonene. So limo, like you pull up in, and then Nene. It's a terpene. So those of you that aren't marijuana dorks, become one. Like those of you, I have a couple of friends that I'm just like, well, what kind of strain is it? I would ask them in conversation, and they're like, I don't know, it's just weed. And I'm like, well, if it's for, trigeminal neuralgia, you need to learn. I said, because you will pay like I even tried the Kansas marijuana, and the 2 strains that are legal here, like Delta 8 and something else, guess what? They have limonene in them, but I didn't know that. I normally am smart enough to check, but I was really tired. I've been going through a lot in my life, and I didn't check. And I think I had a chocolate with some Delta 8 or something in it. And that's when I was at the storage unit, and I turned to the girl and I'm like, I'm gonna have a TN attack, and I know you don't know me, but we're gonna get real close here. So please, for your own sake, like, educate yourself. If someone wants, even in a dispensaries obviously would know the strain, but limonene triggers and activates the trigeminal nerve, so it works the opposite way. It makes it worse. I know it's crazy, but there is backing for this. If you look in the groups, other people have experienced that also. Let's see. Sorry, I know okay, so there's herbs that can help you too. Lion's mane is a nerve pain pill. It's an herb. Again, talk to your doctor. Don't just take stuff because I'm saying, hey, this is good and it helped me. Take it because, check with your pharmacist and your doctor because stuff interacts. Let's see. Essential oils. Just try different ones. I mean, copaiba it just kind of varies. I mean, like, when you're in really bad pain, it's not going to make a big difference. But if you're just maintaining kind of every day, helping yourself with pain, it can make a difference. Frankincense, I guess, is probably the one I'm thinking of the most that helps with pain. But anyway, so here's a note for those of you, if you get a stomach flu, which we've all had those, or food poisoning, and you can't keep liquids down. Puking is a #1 trigger for me. If I puke, I am going to have a TN attack, and it's going to be a bad MFer. I'm really working on not cussing. It's a bad habit I used to have, and I'm trying not to do it. So it's going to be a big, bad, ugly one. So this is embarrassing to tell and talk about, but maybe it'll help somebody, because I was terrified. I have heart issues. I legit could have died when this happened. But what you do if you cannot get liquids in you and you don't want to have to go and get poked, because I don't have veins anymore from all my life with TN, because you end up in the ER a million times a year and your veins. And then I had IV treatment with like certain medication that affected my veins. So it's just a cacophony of things that came together and made my veins just say, we're done, all of them together in a symphony, no more. So I'm getting a port soon. I pray to God very soon, but sad that I'm happy about getting a port, right? But it's like one way to just get things in and out if they need to. Blood, meds, whatever. You can take blood and they can put meds in, I think. But so, stomach flu, back to stomach flu. I couldn't hydrate myself. I didn't want to go to the ER because I don't have my port yet. They're going to sit there and say, no 42-year-old needs a port. This woman's crazy. And they're not going to give me one. Or a central line would have been really good too. And anyway, so what I came up with was, and this just came to me, and I give credit to God because I was praying. I was praying really hard. I was terrified. I thought, the only other opening to hydrate myself is my rectum. I know, TMI. But I thought, okay, an enema bottle, like the hydration stuff I'm supposed to drink, like the IV, that little box I showed you. It's kind of like Gatorade, but way stronger, and it makes you feel so much better when you drink it too. So it's important, and again, don't follow my advice unless you talk to your doctor. I'm not a doctor or even a nurse. I just have way too much medical knowledge, and I'm a medical geek. So, and I have medical family, and anyway, I put the IV liquid, I just kind of put it in an enema bottle. Of course, lube up the enema end and give yourself some hydration. It helped so much. I was able to fall asleep because when you are very, very dehydrated, it causes the pain in the muscles. When you're dehydrated, your muscles tense up, and then that will cause, of course, everything else to tense in your face. So rectal rehydration is a new thing I came up with. Crazy. The last thing I'm going to probably share, I think I'm running out of all my tips, at least for now. There's a lot more that I can think of, but I will share later. So this is like something that somebody told me, and I just kind of I took what they came up with and modified it for me over the years. So what they did is they took 2 cotton balls. I'll go ahead and do it in front of you guys. Hold on. Hold, please. Okay, this really doesn't take that long. So you just need cotton balls and this Scotch tape, like this 3M, I think it's called. Let's see, 3M Scotch tape. Okay, so here we go. Cotton balls. I've got a really deformed arm. Pardon my... So you put the cotton balls on the tape, wrap the tape around, and then sometimes I'll take another one. So see the tape wrapped around the cotton, and then take another piece and set there. Sorry, that's kind of lopsided. So there's the tape. So you do one crossway and one the other way. So when I was in the very beginning, I was really in pain, and I couldn't sleep because I would clench down so hard at night. And so I would make one of these and I would fall asleep with it. And I will tell you, it is better than any, sorry dentists, I've tried lots of night guards, lots. Way too much money, at least for me. This is way better than any night guard because it's soft, it's cushiony, your jaw can go where it wants to, it can move. They've tried it, and I don't know. All I can say is this is great. It's super simple and small, but try it one night, and you can make it bigger. You can put a bunch of cotton balls and then put a bunch of tape, super cheap, throw it away every night, make a new one, or be gross and don't, I guess. No. So I graduated from that, and I'm going to show you something it's always super embarrassing for me, especially when I start dating somebody, because they're like, what are you doing and what is that? And I just kind of had to get over it because it's my life, and I share about my disease with people very early on. I figure, if you're going to date me, this is going to be a part of my life, and I'm just really honest about what it looks like. I kind of have I tell them, hey, when you have about 30 minutes, I want to share something really important, and I tell them about it. But anyway, okay, a bunch of colorful little cubes, yay. So I can send you they're basically they're foam. They're little bitty, teensy tiny foam cubes. They're probably about the size of fingernail, kind of. It's very tiny, anyway, anyway, I keep these in my mouth. I have one right now in my mouth, because sometimes when talking gets really painful, and talking is a number one trigger too. It's up there. So right now I'm transitioning, and I'm talking to you guys while I'm biting on the foam cube. So now I don't have to move my jaw. You'll notice my jaw is not moving as much, but I'm still talking. And so when it's really hurting, like let's say I'm having a really important conversation with somebody, or I'm on the phone in the middle of a really important phone call. I don't know. I'm not giving good examples, but you know, we're all living life, and life involves talking. And for me, I had to find a way to keep talking. I didn't have people to talk for me. Sometimes I have people make phone calls for me because it hurts too much. And so it's hard to explain unless you do it. Maybe this is not your thing. Maybe it'll save your life. Like maybe it'll become something you're like, wow, this really helps. It can't hurt. It's a little cube. Put it in there. So yeah. And then I guess the last thing that I was going to say, I just thought of, is that I talk to my neurologist, and every 6 months I have a surgery where he burns away, it's kind of like the backdoor nerves to the trigeminal nerve. So it kind of short circuits like if I'm having a TN attack, it short circuits the message from the brain to the face saying, ow, ow, you know, steak knife, steak knife. So then it doesn't feel as bad. It takes the pain down a notch. Like you'll still have attacks, but it takes it down a notch. And it definitely, for me, for about a month or two, I'm almost pain-free. And it's amazing. I just remembered one other thing. And I can tell you guys more about that if you want to message me. Sphenopalatine ganglion nerve block. I'll say that again. It's a mouthful for some of you probably. Sphenopalatine ganglion nerve block. It's abbreviated in SPG block. There's a doctor or dentist. There's a dentist in Chicago that will train you how to give yourself one of those. With insurance, it's like $1,000 a nerve block. Basically, it's just sticking a giant Q-tip soaked with lidocaine, like the stuff they put in your teeth when they do a filling, soaking it and sticking it way, like, woo, like it's probably that far up into your nasal canal, but it hits a certain nerve, and when it deadens that nerve, and the dentist said that I could walk around with that for as long as I wanted to. It's a godsend. I mean, honest. I mean, I had to pay for the plane ride. I've tried so many things, you guys. Like I've spent so much money on this disease because we all would give anything to stop the pain. It's why it's called the suicide disease. So having this, I really hope it helps somebody. I really do. But anyway, I can give you that. It's Ira. I think it's Ira Shapira. I can't believe I remember his name. He's a really nice dentist. There's a horrible video of me on his website, I think. So I didn't look so good that day. I was in a lot of pain. But yeah, hopefully he still does that. I hope he still trains people. Yeah. Anyway, my face is starting to hurt from talking, so I'm gonna call this good for tonight. I really hope some of this has helped. If you guys want to message me, you can. I didn't think about how to do this. I think you can comment on YouTube, on the YouTube channel. So I'm just going to test that out because I don't really want to give out email and stuff. Kind of new to this. But anyway, have a wonderful, wonderful day. And please hang in there if you have TN. It is something you can live with. And the thing we all chase is that you can have remission. It's like cancer. But you can have periods where it goes away and is not so bad. So just hang on for those days, because maybe months, maybe years. It can go away for a period and get better. So just hang on for those. All right? Thanks for listening. And I guess if you think this channel might help anybody else, like it or whatever. I'm not really big on social media and like having 1,000 likes or followers or whatever, but I do want to help people. So, you know, sometimes people will listen to something if it has more popularity or whatever, than if it doesn't. But I do know I've gone through a lot and learned a lot, and I just want to pass it on. So have a great day, guys. Thank you.